It's interesting from an historical point of view, and everyone's got a little bit different take on this, but remember that the EPA was the creation of a Republican administration with bipartisan support because of the recognition this was a public health issue and this was not a political issue. And so the EPA has gone through its ups and downs and so forth like that. But before we come to the current administration, don't forget that Congress cut the EPA's budget by on the order of 20%. Just a few years ago. And so now the proposition is that we're going to cut it by, 30%. So we're probably looking at an EPA that's less than half the size of what it was 8-10 years ago. Now it's interesting because people, in my experience, they say, oh, the EPA will take care of that. The EPA needs funds to do things as well. They need that both to do research and they also need it to conduct regulatory oversight. A lot of people don't know this, but the EPA is at the federal level, and the states are down here, and the states are what implement the regulations. Now, there's a few exceptions to that have to do with Native American sites in a few states which have kind of given up on doing anything. But so this is called primacy. So the EPA sits up here, and everybody refers to the EPA as a source of guidance and things like that. They're supposed to be where the expertise lies. And if a state fails, like Michigan did, the EPA is supposed to be able to step in. Now, of course, I just would remind you that in Michigan, when they failed, the CDC, for example, was called in to deal with a concurrent epidemic of Legionella, but Michigan said, no, we don't need your help. So there is this kind of need to have a strong EPA that's able to deal with these common public health, common sense problems that we have. So I'm actually quite pessimistic that we're going to have anything remotely at the same kind of level of things. I mean, if the EPA makes it through this period of low support, I think that what we're going to see is the guidance of the last decade being projected forward. But do I see any far-sighted kind of stuff around, for example, mapping where the lead risk is, and then the pressure to do this that's pushed by the EPA to the state and then the local level? I think that that's unlikely. And so I'm really very concerned about that.
Right, yeah. I'd be curious to hear what you think, Eric. Obviously, your website seeks to fill that gap in some ways, but...
Right, so EPA is one of the cornerstones of the data, but it's not the only. EPA actually, they have a division that actually enforces those who exceed the EPA action level. It's their ECHO enforcement database. And oftentimes I already noticed in data that there's high lead levels, but there's actually no enforcement flag that's been instituted by the EPA. And I think when you cut an agency by 31%, even if all the staffing is still maintained for water, I think the enforcement capability will be much diminished. And also the updating of data, I think also U.S. Geological Survey will need to step up a lot of their sampling of groundwater, which is very susceptible to fracking, for example, and other runoff contaminants that a lot of rural America is entirely dependent on, and which right now is a completely black box. So EPA can only play with the cities that do report, and also many cities, if they're small to rural towns, they only do testing once every 2, 3, 5 to 7 years. Once, every that long of a period. And right now, I could see so much of those testing and also enforcement of these regulations falling by the wayside. And so I think for the states, I actually think for Michigan, instead of basically kicking the can around, we need really, really good leadership on the state level, and that's why I'm actually very proud that the Detroit City, a former city health commissioner, Dr. Abdul El Sayed, is actually running for governor because you really need public health leadership to solve these kind of issues. And for Michigan, I think that's what we really need.
As a citizen, I'd say infrastructure has frequently been funded locally, and so the real pressure point as a water supplier comes from our customers. So EPA is great for setting guidance and doing research, and they have moved the ball forward in the decades since the Safe Drinking Water Act was first passed and EPA was first created. But real decisions on whether investment is made in water are made at town meeting. They're made at city council. They're made at the water board. And they're made because customers, citizens say, we want to have better water. So get your water quality report. If you don't like it, if the data on Eric's website doesn't please you, talk to your local folks. Because even without EPA, progress can be made locally. I want EPA to be strong, but local actions it's where the rubber hits the road ultimately.
And
EPA doesn't give us money for water pipes.